Welcome to the Reverse Mullet Healthcare Podcast from BP2 Health. We are live at the ACLM conference in Orlando, Florida, 2024. I'm your host, Justin Politi.
I'm Dave Pavlik.
And I'm Ellen Brown.
I'm Gebre Nida.
Tell us about...
Thank you for joining us.
Yes, and so on our journey with outcomes-based payment transformation and the linkage with lifestyle medicine,
Right.
You were probably one of 3 or 4 people that just immediately popped up as legends in success and in tracking clinical outcomes, and just your program is just the perfect example of the power of lifestyle medicine economically, right? And I mean also for your patients. But
Right.
so yeah, tell us about
a unicorn, and I was trying to find our unicorn.
I don't know where our unicorn were. You are the absolute. He is an absolute unicorn.
Yeah. So I needed the. It's gone.
That's all right. We had a unicorn.
I think
sitting
somebody
here,
lifted
yeah,
it.
So yeah. So tell us about your program and your successes and. Yeah.
I was born and raised in Ethiopia, about 9,000 miles away. Before I came, diabetes was a rare thing in Ethiopia because you have to afford the extra calories that lead to type 2 diabetes. We would see rare type 1 diabetes, and there is this rare kind of famine-associated diabetes. And then I had a chance to come to the US with MD degree, specialized in internal medicine and endocrinology, and joined the US Medical Force in 2009. In Greensboro area, I'm the only endocrinologist in one county. And then as soon as the shop was open, floodgate of type 2 diabetes. Not to mention that I didn't have experience during residency and fellowship. I saw, lots of patients with type 2 diabetes in Detroit, but I did not expect myself to spend 75 or 80% of my time spending treating type 2 diabetes. The training was not very good about reversing diabetes, but it was very good in diagnosing and treating it.
Exactly.
Pathology and pharmacology. So, for the first 10 years, I thought I was doing a good job following guidelines, prescribing this, prescribing that for my patients. And then by sheer accident, 3 years ago, I knew about the existence of lifestyle medicine and American College of Lifestyle Medicine. Long story. But right after I knew about it, I downloaded some resources from the ACLM and created a package and started to give it to some of my patients. And then, sure enough, patients were actually ready for an option. They were ready to accept treatment alternative instead of expensive medications like insulin. Because by the time they hit my door, it means that the A1C is through the roof.
Yeah.
They have been dealing with diabetes for 10, 15 years, and they have no other choice other than getting on insulin or some expensive, elaborate regimen. So when I start to give this package to these patients, some of them would come back in a couple of weeks with remarkable results. And after I miss the first few, I start to document some tally patients coming with A1C of 3-point drop from 10 to 7 and LDL dropping by 50 points. They're losing 20 pounds between 2 visits, 3 months apart. And then I wrote an abstract on my first 45 patients, and I presented the poster, ACLM conference. That's what you saw probably. So after that, it caught the attention of my system. They're trying to support me. I have a steering committee, a charter. Eventual plan is to roll out this lifestyle medicine to a larger number of patients for the outcomes. I have 200 plus patients now with similar results, and I'm excited. I feel like I found the call.
So tell us the results. Some of those results of that from that research poster, because it's insane.
Yeah. So an average drop of A1C of 3.4.
3.4.
In what period
between
of time?
2 visits, like 3 to 4 months. Average drop in LDL of 61 points from 133 average to 72 without further addition of medications.
Wow.
No insulin, no statins, nothing. And then average weight loss of 26 pounds between 2 visits for the first cohort. And then I expanded that over a year and still maintained that change. Average A1C close to 3, weight loss of close to 20 pounds, LDL about 45 points in a year. Before that, I would see a yo-yo, patients control some time and they lose it back. Now that's a durable change because patients adopted behavior change. So that's remarkable.
Why isn't this on the front page of the New York Times, the Washington Post, like every media
Wall
outlet?
Street Journal.
Right. Like name whatever, right? And why aren't we storming Like,
I know.
To get this in every
that's why
single...
Casey, so that is why Casey Means is making such a difference, because she's at least preaching this in a way that people understand it.
I mean, when you hear outcomes like that, it's like, why in the world are we doing things the way that we're doing it when we have such good results?
Yeah.
Like, I don't know. To me, I know I'm ranting, but
what other resources are you giving those patients or tools aside from, you said you give them packets and send them home, but what?
So to go back to his question,
I'm a mullet man.
I can give you a list of reasons, but we needed people like you to take it, to the public. So the resources I give to my patients, the papers and time, 10 to 15 minutes of time. Unfortunately, I cannot give it to every single patient because I have to see 20 plus patients every day. I select some patients, like the last patient, the morning shift, the last patient, the evening shift. I sacrifice my exercise time, my lunch time, just to see. And then I didn't have to prove the concept of lifestyle medicine. But in fact, I'm not even equipped to deliver the 6 pillars of lifestyle medicine. My strength is, diet, probably some talk and exercise. I don't have a mental health. I don't have sleep study. But can you imagine if you have a team ready to deploy the 6 pillars? These outcomes would be multiple fold, like many fold.
So what are your barriers for being able to deploy all 6?
Time.
And also, we talked about this last night. It's health system.
The resources, right?
No, the health system doesn't see the economic value
that's
prop
what I'm saying.
of it.
Correct.
They need the resources, but they don't want to provide them because it's a
fee-for-service RVU-based model.
Yeah, it's like it's an expense as opposed to
a service line.
Yeah.
And then eventually there's less volume on the back end for them if you're healthier, right? So that's the other threat that's in this room that, but we just need to be demanding that this happen, we got ourselves to this state.
Yeah, exactly. So the way I bill is not even, I'm not mentioning lifetime. I mentioned some concepts of lifetime medicine, but I include some language in my notes and bill one level up from level 3, level 4, level 5. That's how I survive. But when we have a platform which values lifetime medicine better, this is the medicine we need for the 80% of our medical burden and cost.
Absolutely. Absolutely. This is like a full episode worthy, right? I feel like there's so much here. I said we were talking last night and Ajay was part of the conversation and I said, we need to sit down and I need to help you as clinicians to better understand the economic value proposition that you bring your system so that you can also, the same way that we want to be champions, you have the better verbiage to be champions as well with your leadership. Is like, that to me is a big void here. Is not only do you have the burden of I have to learn to treat lifestyle medicine, which isn't something that's taught through traditional medical school. Now I have to become an economist, right? I learn all these different things, but it's just
an ROI cheat sheet.
Yeah, an ROI cheat sheet. That's exactly it. Like I told him, I was like, I sent Ajay an email. I'm going to forward it to you. Like just some of the facts that because we just had somebody in here who's all about pop health, value-based care. She knows that so well and has implemented that in an IPA that takes risk. And so they see the true economic value of this. And it's like, how do we, get the virality of this is the way we need to be practicing medicine. Right? Like, which is why we're here to try and help that message. But then B, this is the way that we take 2 trillion out and then we redeploy it. Like it doesn't just go into the vapor, right? It's the ether. It's like we can do something with it. It's, give people choice again.
Yeah. So I may go back to the option again. So I gave this package to 500 plus patients. 220 came back with similar results with my first 45 cohort.
Wow.
And then 10 of my patients are no longer on medications. And these people came with double-digit A1C to my door. And then a bunch of them are on a minimal dose, just one medication, just to maintain. And then, the NIH data from 57,000 patients, one drop in A1C saves 13% diabetes-related cost.
Yeah.
So there's a whole lot of
and you're not even and I think what's beautiful,
it's a no-brainer.
It is, and I think what I love about the simplicity of this is, we talk about the power of being able to deploy, like you said, like if I could have a fully integrated lifestyle medicine clinic, right?
I feel like we need to put numbers on people's t-shirts and walk around with I say like each one.
Right. I dropped the A1C 3 points for 500 people in 3 months. Like, yes, I love it. I think we should. Like that's but
I saved
13%.
Right.
Yeah. I saved this many $1 million. Yeah. Yes. But I think thing is this shows the power of simple. Like not only is lifestyle medicine a simple intervention, but it's also you haven't even pulled in the food yet, right? You're not deploying food as medicine. You're not deploying mental health. You're not, right? You're just doing this one little component and you've had wild success, right? So it's just a demonstration of the power of lifestyle medicine. It's why we took the time this week to be here and
that people want to get off their medications. Right. Like who wants to be on medications for the rest of your life? You know what I mean? When you have
the disease burden.
Yeah.
Exactly. You know, when I joined medical force in 25 years ago in the US, one of the first intriguing questions I have was, why are so many patients on so many medications? Why? 15, 20 medications and we still expect them to go to work.
Yeah.
I mean, most of the medications are prescribed for a side effect for another expensive medication.
Oh, okay. Yeah.
So, and no one is really willing to sit down and revisit those plans. So once you are on a medication, good luck. You will be on it forever, whether you're...
And it gets autofilled.
Exactly.
That's what slays me. Like I go to my parents' house and there's like 3 new bottles of the same thing. He's like, well, they called me from the pharmacy and said it was ready. And I'm just like, oh my God.
And then the other one is like the nurses that we worked on in our health plan, they go on visits and there are people who have bowls of their medication is in bowls.
Right.
Like, and how are you figuring that out that you're interacting?
It's very difficult. It gets complicated, especially as you age.
Yes.
50, 60 is very high risk. Plus, one other thing I have to add, lifestyle medicine gave me a chance to address diseases where they generate. You know, type 2 diabetes does not happen in the clinic. That's where we're trying to fix it. It develops in the kitchen, where people live, where people work. So we have to go there. That's why I love this concept of community as medicine.
Yeah.
We have to go upstream several layers, not just type 2 diabetes, cardiovascular disease, dementia, stroke, all
cardiometabolic syndrome.
Develop where people live.
Yeah.
We have to go there if we are serious.
To meet people where they are.
Right.
So
this has been awesome.
Yes.
Thank you.
Yes.
Thank you so much for being
Thank
here.
you for the opportunity.
You've always been my hero, so I'm so glad.
I
Plus I always love your Boston.
Yes.
Boston Marathon. He's an amazing runner. Talk about amazing physician, equally accomplished runner.
Talked to him a couple of months back, right?
Yeah.
I remember. So, well, thank you so much for joining us.
Great seeing you.
I appreciate it. Thank you for the opportunity.
Thank you.